Hey everyone, just a quick update to show some improvements over my last version of these coffee filter masks. As I've been trying to be very good and stay at home, I've had lots of time on my hands to play around with the design of these things. Just a quick disclaimer here at the head, these homebrew masks are simply my solution in these uncertain times, but I'm not a medical professional, and these are in no way suitable replacements for federally tested and approved medical respirators. Okay, I was finding that the first version of these really weren't holding up for longer than, say, 10-15 minutes. Moisture from your face would hit the mask, condense, and soak into the filter, which is really just paper. Now, 15 minutes is certainly long enough to run into a store where you might be exposed to less distancing, and these cost pennies to make, so not a big deal, but I wanted to see how I might be able to make the mask a little bit more resilient and effective. So, ironically enough, I started watching the Netflix series Pandemic the other night, I guess because I wanted to find a way to make myself more neurotic. But part of the first episode takes place in India, and the doctors there were treating their patients with a style of mask that looked like this. Now, when I saw this come on screen, I said to myself, that kind of looks like a... Now, despite looking like Howard the Duck, there are actually a couple distinct advantages of this design over the original. For one, the seal. The seal around the face is really excellent. In fact, one of the ways that they test fit real N95 respirators is to have you exhale hard so you can feel where the air is escaping around the perimeter of the mask. And this is just excellent. Another advantage is the space. While it does give you this beak, this space in front of your mouth allows condensation to dissipate a lot more gradually and keeps the integrity of the mask holding together for longer. And the last point is talking. I noticed with the other mask that because of its shape and how it sits on the face, when I spoke it had a tendency to ride down my nose, which is really not what you want out of your mask. This one stays solidly in place. You can talk a lot more easily without it moving. Okay, so here's how you make it. So this version takes 2 number 4 filters, and as I said in the first video, these come in a pack of 100 and cost about $4. You also need 2 rubber bands and a paper clip. Start off by taking one filter and turning it inside out. This will serve to give the mask a little bit more structure, as well as doubling up on the physical filtering. Doesn't have to be perfect. Then open up the other filter and slip the reversed one inside it. Next, you want to fold over the sides, angling a little bit towards one end so that you end up with something that looks like this. This is where your nose will go. Take a paper clip, straighten it out as best you can, and then at the midpoint, bend it around your finger into a U. Place this across the bridge of the filter, a little bit in from the edge, and you can either tape or hot glue this into place. And then lastly, take 2 rubber bands and attach them to the sides of the mask with either a stapler, tape, or hot glue, whatever you've got on hand. If you are stapling them down, try to make sure you're going through all 4 layers, or you can also tape the outside as you are physically puncturing the filter. You'll have to flare out the paper clip a little bit and adjust it to fit your face, but that's it. You're done. Now these only filter down to about 20 micron, which is still about half the diameter of a human hair, whereas N95 masks go all the way down to 0.3 micron. I don't know what the filter efficiency is of 2 of these stacked together, but pretty reasonable level of protection for about 10 cents in materials. In fact, I'd love to find a way to flow test the efficiency of these. If anyone has any ideas or access to facilities that do that, please reach out. I want to stress again that these are for short-term use. You shouldn't just be going around wearing these all day long. You are putting a physical barrier in front of your face, much like a N95 mask, that is restricting your breathing and airflow and will make your lungs work a little harder. These are really just about protecting yourself when you know you're going to be in close proximity to other people, thus exposing others, being exposed yourself. Grocery store, post office, public transit if it's still running in your area, things like that. Social distancing is still our primary means of slowing the infection rate and taking the strain off of all the doctors and nurses who are vigilantly working overtime to help keep us alive. Lastly, remember that after use, you want to treat the whole front of the mask as a potentially contaminated surface. So to remove these, wash your hands and then hook your fingers behind the ear loops, remove and dispose. Check out my other video if you want to see how to make a simple antiviral solution for these. And I'll be posting another video soon about how to make a cheap and simple face mask. Thanks for watching. Please share this with anyone you think it might help. In the absence of the broad and sweeping testing that we should be doing, we're really flying blind in terms of knowing what we're up against and the actual rate of infection. But why I'm making these videos is that I believe a powerful tool in combating the spread of this outbreak is information. If we can outpace the spread of infection with the spread of good information, it will save lives. So help spread the word, take care of yourself, take care of one another.